comes the next question. It is if 46-year-old woman comes to the physician for routine examination, she states that her blood pressure was checked a week ago. It was 190 by 120 millimeter of mercury. She has no history of any major medical illness, so no past history, takes no medication. She has smoked one pack of cig for past 20 years. So there is this smoking history. Her temperature is, she's febrile. Blood pressure is 196 over 118. Ophthalmoscopic examination show arteriovenous nicking but no hemorrhage, so it is like malignant hypertension. Physical examination show mid abdominal bruit. It's a big hint. Most of you have understand what is the question asking about. So laboratory studies, so metabolic panel shows sodium 140, potassium is decreased. Okay, HCO3 it is increased. Normally it is 24 around, something like that. pH also increases, so it's alkalosis. PCO2 it's a little bit decreased. PO2 is normal. Urine analysis shows no abnormality. So we straight away think it is not, the pathology is not related to glomerular apparatus. So which of the following is the most likely cause of her hypertension? So yes, so the patient, she is 46 years old. So first of all, you need to check the age of the patient, or you need to look at the first line and the last line of the question stem is very important. So in the first line, you usually get the demographical details of the patient and little bit of etiology you get to know by reading the first two lines. Like it's just a routine examination, no major medical illnesses. Okay, so there is no like any comorbidity or anything like that. And last line is important because sometimes you just have, first what I used to do was I straight away I used to read the last line. In this way I I it helped me in consuming less time. And it takes some, there were lots of questions where there's a big question stamp, and the last part of the question it was just asking something very basic that that I didn't need to read the whole big stamp. It's like 10 or 20 lines long. So okay, so coming back to this question, look at the options. So glomerulonephritis, it is not correct. Sorry, this I will underline the incorrect by word. Smoking, yeah, smoking is one of the reasons, but this malignant undiagnosed hypertension is nothing to do with smoking at this moment. Moreover, there is abdominal bruit, and pheochromocytoma is also wrong option because there are episodic hypertensive episodes. There sometimes it comes and goes with dizziness, sweating, and urine analysis also shows some substances and pheochromocytoma. So it is not, these three are the wrong. So this option, renovascular hypertension caused by atherosclerosis, yes, this can be right. Renovascular hypertension caused by fibromuscular dysplasia, yeah, this can also be right. So how we can come to the one option among these two? So I chose this question because it's very tricky. A lot of you might think, even I used to think, why this renovascular hypertension caused by atherosclerosis is not the right. By the way, this is the correct option, E. Let me mark the correct option. This is the correct option. Okay, so why this is the right answer and this is wrong? It is because when you have atherosclerosis disease, you have some other accompanied things, like you might have a history of stroke, ischemic heart disease, or maybe peripheral arterial disease, something like claudication or anything like that. And this patient has no history of any vascular arterial disease. And moreover, the age of this patient, it shows, and this metabolic profile. So this metabolic profile can happen with both yeah, renal atherosclerosis and renal fibromuscular dysplasia, because in both of these two, um, there's lesser blood flow towards the glomerulus operators, towards the nephron. That's why less GFR decreases, renin increases. It causes, angiotensinogen to convert into ACE inhibitor, then convert into angiotensin 2, and aldosterone secretes. Aldosterone, it constricts the efferent arteriole, so that's why it can help to increase the GFR, and simultaneously aldosterone, what it does is it excretes potassium. That's why this potassium level, it decreases, and also it excreted hydrogen ion. So basically, when one hydrogen is excreted, the one bicarbonate generates, and pH increases. So it's kind of metabolic alkalosis. Okay, so this is the fibromuscular dysplasia is the correct answer. So we can proceed towards the explanation. So you can see in the explanation that this patient most likely has renovascular hypertension. Okay, very well said. Caused by fibromuscular dysplasia. Okay, this is evident by low serum potassium, as I discussed with you, metabolic alkalosis due to hyperaldosteronism. Okay, the abdominal bruit, that it goes toward the fibromuscular dysplasia leading to renal arterial stenosis, as I mentioned. High aldosterone commonly affected middle-aged Caucasian women. So middle-aged women, whenever there is without any other arterial disease, claudication, or any other thing, you straight away go to the atherosclerosis. Fibromuscular dysplasia. So if this question is different, like the last, it says what is the most likely next step, or what is the next step for the diagnosis, or next best step. So then you have to choose a MRA or CT angiogram, whichever is given. They usually don't give both of these, or even sometimes before the CT angiogram you can go for Dopplers or duplex ultrasound, Doppler's ultrasound of abdomen. That also gives you an idea that what is going on with the arterial pathology or vascular disease, any if present. So yes, renal artery angiogram, MRA. Before that, you can do ultrasound or Doppler. Okay, so the if the question it could they can also ask you what is the most likely treatment, or what is the best treatment option. Then it is angioplasty. Okay, this patient has a normal urine analysis, so no evidence of glomerulonephritis. I told you smoking and pheochromocytoma also not an option. So yes, this patient has no other evidence of atherosclerotic disease, so it is less likely that atherosclerosis is the etiology. So you need to look at this. This was a tricky question. I also did it wrong many times. So these kind of questions can come in your final day exam. So you need to, always what I it always helped me to look first what the last line, what the question wants you to answer, and the first two lines are also very important to kind of guess the etiologies, and then you have to quickly go through all rest of the body. Okay, so this is how you answer these kind of questions. And yes, we are coming up with more and more videos, so this is just a start. So stay in touch if you need to know the tricks. We can, you can also comments down that how you want me to make the videos, or how we can make it more interactive sessions maybe. So you can give me a feedback here down in the comments, and just get ready for the next video, and don't Forget to subscribe only if you want. Okay, thank you.